settling in and joining the meeting. I've just got something that came on the BBC News just earlier this week, and I would like you to just take a look at this news story. Quite possible that you've seen it already. It's quite an interesting concept, and if you would just take a very quick read of this. I know that you all work in health and social care, and I know that the majority of you are working in adult social care. I would like you to just give me a one-word reaction to how this makes you feel, because it's always good from me to just hear from people on the ground how you think this affects you, or how you think it's going to affect the delivery of social care and how it's going to affect your sector. Ella's put a poll up for you to write your response, and we're just really looking for anyone who's already read it or anyone who's reading it now. One word reaction. How does it make you feel? And for anyone who, I know there's a few people who have just joined us just a minute or two after we started, just to bring you up to speed, we just are asking you to put your name in the chat so we can keep a record of who's attended. And what we're showing on the screen right now is a BBC News story that was published on Monday this week, and it is about the I think the dilemma that all of you who work in adult social care will be so aware of, and that's the whole idea that this is a very underfunded part of the sector, and we're asking you to put in the poll that Ella is sharing with us now just your one-word reaction, so that we can get a feeling from the group of how this makes you feel. We know that it's a real challenge for people working in social care, in adult social care, to deal with the restrictions, the financial restrictions that you are currently living with, and certainly from the perspective of the beneficiaries of social care. We hear these kind of stories every week. So it would be interesting to see what you think. Ella, how are we doing with some responses?
So I can't see any responses yet. I'm not sure if there's a bit of a delay on my side, but if the word cloud isn't working for anyone, feel free to put your one-word reactions in the chat as well. So we've had some words in the chat: unsurprised and worrying. Crisis.
Like, it's quite amazing, isn't it? Just reading it again, and taxpayers are paying £32 billion a year for a broken system. And also the thing that's is popping up here is the whole notion of unpaid carers. I know that one of our practitioners who's part of this project is doing a lot of work with looking at unpaid carers, and people, because they might be in receipt of an attendance allowance, don't realise that they are actually unpaid carers. Okay, any other words coming through, Ella?
Yes, so dysfunctional has just come through as well.
Anyone else want to add their?
There's also a comment in the chat about social care services not being taken seriously.
I think that's been going on. That's quite historical. It's been going on for so long. And the report has said that an extra £1 billion spent on social care will create 50,000 jobs. I wonder where they're going to get the 50,000 employees, because social care, I think, struggles to recruit, certainly in healthcare. My background is nursing. I think those of you who were with us on the last webinar will know, and we are really struggling to recruit student nurses. And it's not just our university, it's across the sector. So, it doesn't bode well. Okay, I think we've had a few more comments come in. Ella?
Yes, there's another comment in the chat that says NHS England first, who is next? Social care? Question mark.
Yeah. It's strange once they separated out health and social care into two different parts of the sector, the whole thing seemed to fall apart, not just from a financial perspective, but from a communications perspective as well. Okay, so that's interesting. No, it's interesting to hear your responses to that. It doesn't sound like anybody is particularly encouraged by it, which is what it should be. Okay, well, we're here today to talk to you about quantitative research. And, I think the whole idea of how we're going to influence policy in the future has to come from an evidence base, and it has to come from data. It's the only tool that we have to be able to influence policymakers and our politicians who make the decisions on how the funds are being spent. And so today we're going to talk very much around quantitative research. So the last time we got together, we looked at qualitative research, and now we want to look at something that's slightly different. Just going to I think there's just a couple more people. Ella, if you just want to reiterate the housekeeping rules that we had.
Yep, just to let everyone know the session will be recorded, and just to please keep yourselves on mute throughout.
Okay, so what we're going to do, I think that some of you were with us the last time we ran one of these workshops, and we're going to start off just by having a very quick recap of what we covered in the last workshop. And when we did that, and these will be available, we'll send you the links later on our new YouTube channel. But we looked at how a research study was constructed, and whether it's a study that's collecting qualitative data. And by qualitative, we're looking at narrative, we're looking at people's views and opinions and beliefs, or whether it's using quantitative data, which in essence is figures. The study should be constructed in more or less the same way. And we know that if a study goes through the stages that are predetermined of a good research study, it's easier for us then to see if all the correct stages have been followed, all the rules have been followed. It makes it easier for us to make a decision as to whether the research is valuable. So let's just start off by talking just a little bit about the research question. And so it's one of the first things that I would look at when I pick up a new research paper. I need to know that that question is actually researchable. And the general rule of thumb is that it shouldn't be an ethical question. So it shouldn't be a question that starts with the word ought or should. Generally, these aren't researchable questions. However, that's not to say that a question shouldn't have an ethical dimension. It certainly could. So, for instance, a question about, maybe let's follow on from our news story about unpaid carers and whether or not they should receive financial support for their efforts. That could well be the focus of a research study, but most likely it would be something like, what are the views of unpaid carers on receiving financial remuneration for the caregiving services? Or what are the experiences of older carers in managing their finances whilst contributing to the care of a loved one? So getting the question right is absolutely crucial. And we'll talk a little bit more about the question for the example paper that we have used for this webinar as we go through a little bit later on. So just to build on what we talked about during the first session, a little bit of new language, because these questions and views that we talked about in the last session were all about people's views and beliefs and thoughts. And they were very much coming from an interpretivist paradigm. So this is some new language. And we need to think about that word paradigm and what does it mean? Because one of the difficulties that we have with research is that there's a lot of language and a lot of, I guess, jargon, which people find very daunting. And so if we can just demystify that a little bit, I think it should make it easier. So what's a paradigm? And so this word cloud shows all the kinds of things that might come into the realm of a paradigm. And to just put it as simply as I can, It's just a way of looking at the world or understanding the world. Think of it maybe as a set of beliefs or assumptions or just concepts that shape how we interpret things around us. So from a very basic perspective, just think about wearing glasses. And if you wear glasses with a red tint, everything you see will have a red hue. Similarly, a paradigm, it just acts like those tinted glasses. It will influence your perspective and your understanding of what's all around you. And then thinking on from the next couple of new words that we want to introduce at this stage. And this is around two different philosophical approaches. And basically, they determine the two different realms of research that we're focusing on in the last webinar and today. So we have to think about what philosophical stance the researcher is coming from. And if we go right back to the very beginning of when we started thinking about research, it started off very much from a positivist approach. So some of the earliest recorded clinical trials that we know about in the UK back in the mid-70s, there was a Scottish guy called James Lynch, and he started to investigate the effect of citrus fruits, so oranges and lemons, on scurvy amongst sailors. And he did that using an experiment. So some people were given the oranges and the lemons and some people weren't. And it was looking at whether or not they reduced the incidence of scurvy. Moving on from that, Florence Nightingale, whom I'm sure many of you will have heard of, back in the 1850s, she did a lot of work during the Crimean War. And what she discovered was that by better hygiene practices, better sanitation, you could actually improve mortality rate. So this very simple practice of hand washing to reduce infections, we can trace back to Florence. And these are still the foundations for many of the public healthcare practices we use today. But where those two examples sit is in the school of positivism. It's very much around the world is black and white. It's about whether or not the world is right or wrong, as opposed to interpretivism, which was the focus for our last webinar, when we talked about the fact that the world isn't always black and white. We have different views, we have different beliefs, we have different thoughts. And it is about interpreting what we think. And so that really opens up the whole notion of there are two different schools of research. And when you're looking at a research paper, you should be able to tell straight away which philosophical approach the researchers are coming from. And you may well see these words, interpretivism, which is going to lead you towards the fact that the data that will be collected will be qualitative data around people's views and beliefs and thoughts. Whereas if the paper is coming from a very positivist perspective, it's more likely to be collecting data which is going to give you a yes or a no answer. So predominantly quantitative data, which brings us to where we are today and the focus of today's session. And so if we're looking at quantitative data, we're going to see a completely different set of methodologies to what we saw when we were looking at qualitative data. So with quantitative data, you're likely to see researchers using experiments. So similarly, back to James Lynch and his experiment around the citrus fruits and scurvy, back to Florence Nightingale and her experiments around which groups of people had a better mortality rate, comparing it to the or when they had better hygiene practices. So experiments are a very typical methodology that you'll see when you're looking at studies that collect quantitative data. You might also see something that says we did a randomized control trial. Now, just to explode the myth on what that is, it's very simple. It's where participants are allocated to one of two groups. One is the control group. Now, these are the ones who are likely to get the placebo, and one is the experimental group, who are likely to get whatever is being tested. And so, just going back very early, recent times to COVID, as soon as the COVID vaccine came out, and they started asking for volunteers to test this vaccine, actually before it came out, participants would be allocated to either the control group, where they would get the placebo, or to the experimental group where they got the actual vaccine. And that's a randomized control trial, very, very well typically used in drug trials. Lots of other things you might see, different methodologies, I'm not going to go through them all, but you might well see a survey which could collect quantitative data. So very similar to what you're going to see at the very end of this session today, and we'll ask you on a scale of 1 to 5 to rate how useful you found the session. That will give us a statistic. It will give us some data, which is numerical data, which we will then be able to number crunch. There were lots of other types of studies that you will see using quantitative data, and as we go through, we'll see a little bit more about them. But just to again highlight some of the language that you might see in a study which has collected quantitative data, and what these words mean. You might see something about people being allocated to a double-blind study, and that's really quite simple. Double-blind means you'll have two groups of participants in a study, and neither of them know which group they're in. So, for instance, back to the example from the COVID vaccine, a double-blind study means whether you were in the control group or whether you were in the experimental group, you wouldn't have known. A variable, you'll see this quite a lot in studies which collect quantitative data, and this is something that can be manipulated. So, for example, it could be an attribute or a characteristic that can be measured and takes on different values amongst the participants. So it's something that you can change and manipulate to determine whether or not the intervention is going to be useful. What else might you have? You might have hypothesis mentioned, and again that term, what does a hypothesis mean? Well, hypothesis very simply is it's a statement. It's not a question, it's a statement, but it's a statement that can be tested. And what they're testing is maybe a prediction about the relationship between two or more variables. So, for instance, just to give you an example of what a hypothesis might be in very simple language, you could have a hypothesis that stated, drinking a cup of coffee before you study improves memory retention. So if you were trying to test that hypothesis, you most likely would conduct an experiment where you'd have one group of participants drinking coffee before they studied and another group who didn't drink the coffee. And after studying, you would test both groups' memory retention to see if there was a significant difference between them. And if you did, you could say your hypothesis was supported or it was not supported. Another thing that you're likely to see in your papers that collect quantitative data might be mention of a p-value. Now, this is the first kind of mention here of statistics, and I have to put my hand up and say statistics is not my bag, and I think many people who work in healthcare will rely on statisticians when they're writing and conducting research studies, because it's something that we're not inherently either familiar with or comfortable with if we haven't been taught how to do statistical analysis. And as health and social care practitioners, we generally tend to lean towards interpretivist philosophies when we move towards research, because we're very interested in how people behave, how people react, what people believe, rather than the facts and figures. However, if we want to make change and we want to move towards being a very evidence-based part of the sector, we need multiple types of evidence, which is why we're looking at quantitative evidence today. But a p-value, it's a statistical measure that's used to determine the significance of your results. And very basically, a low p-value might suggest that there is a significant effect or a difference, whereas a high p-value suggests that there is very little significance. And typically you'll see a p-value set at 0.05. And if the results come out at below 0.05, the chances are that there is an effect, and if they come out above 0.5, generally, but this is not set in stone, but it would suggest that there's no significant effect. Again, what you will find in most of these studies is that there will be multiple authors. People will have responsibility for different parts of a research paper, and generally, if you have quantitative data, you'll have a fairly able statistician helping you with the statistics and the statistical analysis. Moving on, just a couple of other terms that were on that previous slide: mean and median. I think most people will know what they are. The mean is the average. So if I add 3 and 5 and 7 and I get 15, and there are 3 numbers, so I divide 15 by 3, my mean is going to be 5. The median is something different. The median is the number in the middle. It's the middle value in a data set. So in this example here, 3 plus 5 plus 7, the median is 5 because it's the number right in the middle if you divide the data set down in 2. Just moving on, there are a number of tests which can be applied to statistical as statistical analysis tests if you have quantitative data, and they can sometimes look very daunting. And my thing is that they can actually put people off looking at research papers, but don't let it put you off, because you will be able to see past the statistics and move on to looking at the results and the limitations of the study, but it's just useful to have a little understanding of what the terms are going to be and what things you might recognise after today that maybe you didn't recognise before. So these are some of the tests that you might see. And again, if you get something like this in a research paper, it's not all of them will be familiar to many of us. Some of them are more easily recognizable than others. So you might well see a t-test. Now, t-test is quite simple. It's basically comparing the mean result from both. So just talked about the mean and the median. If you have 2 different groups and you're doing an experiment and you have a whole bunch of numbers, you can look at the mean between the 2 groups, and that's a very simple t-test. You might find ANOVA, again, very commonly used test in statistical analysis, and that's basically an analysis of variance. And so it's used to compare the means of 3 or more groups to see if one group mean is different from the other group. And so again, it's looking at the average of one group, the average of a second group, the average of a third group, and what's the difference between them. Chi-square is another one that you may well see. That's again used to examine the relationship between variables. The Mann-Whitney U-test, it's used again to compare the differences between 2 independent groups. And the ones that you will have seen in the paper that we distributed for this workshop, the Kaplan-Meier survival curve, this is a statistical tool that was used to estimate the survival function from time to event. And it's used, you can use it for retrospective data. It was useful in here to measure the fraction of patients living for a certain time after treatment. And in this case, they used it to measure after the diagnosis of COVID. Now, all of these tools will all be we'll all have statistical analysis packages, which I guess just looking at a couple of them, the thing that you might be familiar with is SPSS, and this is the statistical package for social sciences. Some of these tools can be used and the data can be crunched using something simple like Excel. I wouldn't worry too much about having to investigate exactly how the data was analysed, unless you have a particular interest in it. But I think mostly we work on the premise that the tests are done using statistical packages, and it's the interpretation of the data that then becomes what we use to make some changes or otherwise in practice. Looking at recommendations, again, the same as the last time we got together and talked about qualitative research, a good research paper will follow exactly the same steps when they've collected quantitative data. They'll start to identify any limitations of the study, and they'll then need to identify if further research is necessary to provide further insights onto the topic. And recommendations for future research is usually something that a good researcher will work on. So just moving on to the paper that we have sent to you today. Again, it was deliberately chosen because it wasn't too long. It's 8 pages, the same as the last one. I hope some of you at least have had a chance to look, if not at the whole paper, but at the abstract. It was a paper that was based on quantitative data, and it was a paper which used existing data, which is something that's commonly done. So a retrospective study looking at data which already existed. I think what we talked about the last time is exactly the same as what we need to do today in terms of thinking about red flags. What do you watch out for when a paper like this lands on your desk and you're trying to think whether or not this has implications for changing my practice? And again, it's exactly the same kind of process that we go through. We look at the authors to see who they are and what kind of credibility they have. But one other thing that I want to mention that I didn't mention the last time is about impact factors. And it's quite easy to determine the impact factor of any journal just simply by putting impact factor and the name of the journal into Google. Impact factor is about how often the study in the journal has been cited in other work. So, for instance, the impact factor of something like the British Medical Journal will be very high because it will be cited multiple times in the press. So in newspapers and on TV programs, as well as by other authors who are citing them because it has such a wide circulation. So the paper that we have today is from it's an open access article, okay, and not 100% sure where it was published, or from Age and Aging. Now, if I wanted to find out the impact factor of this journal, I would be able to look it up. My guess is that it won't be hugely high. It's not a journal that I know of, but one of my colleagues has published in it, which is how we ended up with this research paper. But it's also a useful thing to do when you're looking at the critiquing your study, looking to see what kind of impact factor the journal has. As we go through, we're looking at the abstract. We're looking first of all at the research questions. Then we want to know, has the study been well designed and has the design been clearly articulated? We want to know then about the methodology that they used and the methods they used to collect their data. And then moving on, we're looking at the results of the study. A good study will always identify its limitations. And as we move on, recommendations for the future. And finally, the studies normally have something around any declaration of conflict of interest and whether or not there was any financial support for the study. So that kind of is a very quick whiz through of what to look out for when you're looking at a quantitative paper. We are going to just double check that some, at least, of that information has sunk in. And so my able assistant, Ella, is going to let us have a little quiz. And we're going to ask you to join in the poll and to just tell us what you think the answer to each of these questions is. Ella, over to you.
So I'm going to launch the quiz questions as polls, but if anyone can't see them or is having any technical issues, please feel free to just put your responses in the chat. So we're going to start with the first question, which is the question a research question? So I'm just launching that now. Your options are yes or no. So you should be able to see that on your screen. If not, put your answers in the chat.
Excellent. And if we had a countdown clock, like countdown on the telly, we'd be counting down about 10 seconds to give you a chance to decide whether or not the question is a research question. So thinking back, is it a question that can actually be answered? Okay, Ella, how are we doing? Are we getting any answers?
Yes, so we've got 100% answers saying yes so far.
Okay, very sure, and I agree with you. It is definitely a researchable question. And so moving on to the second question, is Ella, yeah.
So the next question is the study design clearly articulated? So I will just launch that now. Again, your options are yes or no.
Okay. Again, it's really important that the study design is clearly articulated because we need to know from the outside that it has been well designed and that the whole research project has been correctly designed. Otherwise, again, we'll start to see some red flags.
So everyone is saying yes to this as well.
Okay, and I can see straight away looking at the second page of this study that they had a cross-sectional cohort study, a very well recognized research design when you're going to use quantitative data. So cross-sectional cohort study is about taking data from different sections of the data set, and a cohort is about a particular group. Okay, next question, Ella.
So the next one is which of the following methods were used to collect the data? So this question has three options, which are focus groups, semi-structured interviews, or statistics. So I am just launching that now.
And again, what we're seeing here is the difference between the type of data that we would expect to see in a qualitative study, where we're looking for people's views and experiences and thoughts and beliefs, to a study which is going to collect quantitative data, which is going to give us very much a yes or no answer or a black and white answer rather than different shades of grey. Okay, Ella, how are we doing on that one?
So this one, we've got 50% votes for statistics and 50% votes for semi-structured interviews.
Okay, and with this one, we kind of tried to put a little bit of a red herring in here, but I think that what we're looking at is an existing data set. So what they used in Wales was data that was already available through the electronic health records and data from SAIL. So they actually didn't do any interviews. They used data which already was collected, and so the data which they had was purely statistical. Okay, the next question is, how was the data analysed?
I think you've skipped past a question, Catherine, if we go back one. Yeah.
Oh, beg your pardon.
That's all right. So this one is, did the study identify how the participant... Oh, actually, I think this isn't supposed to be there.
Okay, I think that was the red herring. Okay, so we go on to this one. How was the data analysed?
So two options here are statistical analysis or thematic analysis, and I'm just launching that now.
Okay, so hopefully you'll understand which type of analysis works with which type of data. So we talked a little bit the last time around what kind of analysis we would expect to do if we had narratives. So if we had stories or we had interview data, what kind of analysis we would use for that. And it's very different to what kind of analysis we would use for numbers. How are we doing, Ella?
Everyone voting for statistical analysis.
Okay, very good. And that's absolutely right. So with thematic analysis, you'll see that when you have qualitative data where the researchers are looking for themes that are coming out in the data set, things that the data sets have in common, things that are happening over and over again. Whereas with the quantitative data, because we have facts and figures, we'll be looking at things like numbers and means and averages and medians, it's much easier to do the analysis of that using a statistical package like SPSS or Excel.
So, final question is, do you think the research has adequately addressed the limitations of the study? So, yes or no, launching that now.
And this is always one that's kind of open to interpretation, because we can see that they have a paragraph around the limitations, but it's whether or not you think that they have been addressed sufficiently. One of the other constraints that people have when they're publishing research studies is a word count. And they have to decide, you have to make a decision as to what you want to put in and what you can leave out. But what did the group think about the way the researchers address the limitations?
So, we have got 100% votes for yes so far.
Okay, that's good. Like, I can see down here that there are kind of two major limitations identified here. And because there were varying numbers of care homes included in each year of the study, and there was a possibility that there could have been some duplication. So, that again, if when you're using an established data set which already exists, sometimes it's difficult. And again, it was anonymized. So the researchers weren't able to always see exactly where the data was coming from. So this is our conversation point, and this is where we're going to throw it open to you. Can you see any red flags jumping out at you after reading this study? Or when you read this, do you think that some of their recommendations would be things that you would be able to, in terms of their discussion, do you think that it signposts you towards any changes in practice?